So without further ado, I'm going to ask, again, in no specific order, Assemblyman Joe Saladino, who has asked to provide some input to this task force hearing. Assemblyman Saladino.
Thank you. Thank you, Senator. Appreciate this opportunity and appreciate the fact that all of you have come here to Long Island to make sure that we keep this issue on the front burner and embrace the things that need to be done in Albany. Those 11 bills that were spoken of that came out last year and the year before, big help, big step in the right direction. Just to give you a little background, those of you on the dais know me. I'm Assemblyman Joseph Saladino. I represent the 9th Assembly District in Nassau and Suffolk counties. I'm a 13-year veteran of the New York State Legislature. Came in the class with then Assemblyman Tom O'Mara. Back in 2011, I went to the funerals for the children of 3 dear friends in 1 year, 2011. It was a terrible situation. You'll hear from other folks who have lost their children, lost their loved ones, including my nephew, who's my joy in this world, his best friend. So it was a big impact, and I was asked, please do something. What can we do? So back in 2011, I put together a task force. There have been many of these task forces. And what we did is we made it, instead of members, we put it together with the experts. People like Dr. Golden and Jeff and the Kroll family, and so many people who know quite a bit about this. And they have been talking over and over about important issues like making sure when patients are in the throes of addiction that they readily get the help they need. So we spoke a lot about legislation that mirrors the PA 106 legislation. And over we've been told about this. And we've been moving toward doing that, and that's one of the very important issues. We talked to people on the federal level, and they have stated that another piece of this is to force the drug companies to do the research to come up with painkillers that are less addictive as that side effect that's going to affect their bottom line. So that's another hurdle that's so important. Moving forward from that point, we worked on pushing for iStop with many of you, so thank you very much. iStop 1 and iStop 2. Going back about 3 years ago, I sat with Senator Boyle, who worked very hard on so many of these issues, and you still continue to do. Thank you very much for your efforts. And from those meetings, at least the ones I attended, we learned of the outrageous situations like Skittles parties, where people pour pills into a bowl and they reach their hand out of there, the Russian roulette of opioid and prescription drug abuse. Moving forward from there, the Assembly minority put together a task force starting last year, and many of my colleagues were involved and continue to be involved in that. And the real hero we have to thank on that is Assemblyman Joe Giulio. His leadership and his motivation on that have been just wonderful. So the Assembly Republicans put out a report on this that continues with great suggestion of legislation, including the one near and dear to my heart because of the task force that I've worked on since 2011, thank you, Terry, of legislation that mirrors PA 106. So I can't stress that enough, to continue to push for making sure that the medical providers and not the insurance companies decide how rehab and detox services are rendered and ensuring that they're paid for. You shouldn't, as Senator Martin said, and you hit the nail on the head, you shouldn't have to fail as an outpatient twice before they'll even begin. And a day and age when Washington tells us everyone should have medical coverage. Yes, including the people who pay for it. Yes. And to deny them and their loved ones that coverage, to me, is an outrage. So that PA 106 type legislation, please take a look at the report that Assemblyman Giulio and the Albany Assembly Task Force has put out to embrace those bills as well and keep on doing what we're doing. The education component, the law enforcement component, and the rehab component is more or less what this all boils down to. And then we could do more to get more providers involved with the issue of tracking prescriptions. because, typical to Albany sometimes, we've made it so much more onerous for them to follow that up, people who are working very hard and cramming a lot into a day. So we have to continue those things. Thank you for your efforts. Thank you, everyone who is here and those who will be submitting testimony. And as Senator Boyle said, we have some of the best minds right here on Long Island on this. And you mentioned Dr. Reynolds, and I mentioned Dr. Golden, and that list goes on and on. They are the people who wrote the recommendations for Suffolk's task force and for Nassau's. Two other documents that are very important. So lots of the answers are out there. The folks here are excellent, and they'll certainly motivate us when we hear of their family stories. And we really appreciate a continuance of working together. Senator Venditto and I have been having many conversations on the issue. Thank you, Senator Venditto, what you're doing as well. And thank you, Tom, for bringing us together today.
Thank you, Assemblyman. Thank you very much. The next speaker will be Councilman Laguercio from Brookhaven Township, the second largest town in the state. A lot of territory and experiencing similar problems. Thank you, Councilman, for being here with us.
Thank you, Senator Croce, and thank you, gentlemen, for allowing me this opportunity to speak on such an important issue. And I very much appreciate what it is that you gentlemen are doing along with the Senate and the Assembly, so thank you. I was asked to speak on a couple of different points, so I made a few notes that I'm happy to share with you this afternoon. As someone who's very, very connected and intimately connected to the community, as a town councilman, I'm also a member of the Ridge Fire Department and EMS Department, 12 years on along with school board. I'm also the Brookhaven liaison to the Youth Bureau, and also as an insurance professional, I have an opportunity to witness firsthand some of the terrible, terrible effects that heroin and opiate and drug and alcohol abuse cause on our community. And I give you an example. The Brookhaven Town Fire Departments alone respond to at least 12 overdose cases per month. Now, Ridge alone, a small community of Ridge, we respond to at least one per week. Okay, they respond to 12 per week, I'm sorry. We respond to about one per week. But I can also tell you that many of the calls that we do respond to come over as sick, or maybe I've fallen and I can't get up, and end up being caused by a drug overdose that we find out later on that don't get logged in as an overdose case. Narcan, you gentlemen mentioned that before. It's been a blessing, and it's also been an obstacle. One of the problems with Narcan is a wonderful drug that it is. The drug addicts feel like they're invincible. What happens is they'll say, IOD, that's fine. My buddy has Narcan. He'll give it to me. Or when the police department respond, or when the EMS respond, they have Narcan, they'll save me, I'll come back, and I could do it again tomorrow. So it's been a blessing and an obstacle alone. As far as raising awareness, in my opinion, absolutely, it begins with education. But we need to begin at the lower grades. We need to start with the little kids, the elementary kids. The gangs are doing it. They're infiltrating the young adults. We should as well, and that's how we need to battle it that way. Also, parents. Someone mentioned it earlier, the NIMBYism. It doesn't happen to my child. It doesn't happen in my backyard. Well, guess what? It does. Okay? We need to teach them how to recognize the signs of drug abuse, how to recognize it not only in their own children, but in their friends. A lot of times they don't want to get involved, but we have to empower them with the ability to recognize their friends, their children's friends' issues that they have, and bring it to our attention, and not be afraid and not be persecuted for that. The community, we need to involve them more, have more town hall style meetings, bring in professional speakers, involve the police departments, show that there is a direct connection between the police departments and the community, help children to understand that the cops are good, they're here to help, okay? And also the civics and the PTAs. Regarding treatments, we all talked about that before as well. I've spoken with licensed clinical social workers. They all say the same exact things. We need more detox beds. We need more facilities. There just aren't enough out there to treat everyone. As an insurance professional, I can tell you, like the Assemblyman said before, insurance companies have the upper hand right now. They say, well, if you don't meet the requirements, then you can't be an inpatient. That's not right. We should let the treatment be determined by the professionals in healthcare, not by insurance companies and by insurance professionals. Absolutely. I think that legislation needs to be changed for that. And lastly, I want to speak to law enforcement. we need to empower the police department. There are certain instances when the police department cannot make an arrest. I understand it. I get it. I'm there when this happens. But maybe we need to look at legislation and maybe tweak that a little bit. And also we need to give them the tools to not only battle drug addiction, but the crimes that are being caused because of drug addiction. There are many ancillary crimes that are committed so that they can get the money to buy the drugs, et cetera, et cetera. So, gentlemen, again, thank you so much for this opportunity, and I very much appreciate what it is that you're doing for our community. So thank you and good day.
Thank you, Councilman Legurcio. Senator Murphy?
Yeah, Councilman, great point. Absolutely great point with regards to there's the task force is looking at what we're trying to do is 90 days, 45 in, 45 out. 15 days is a joke. It's a waste of money. We realize that.
I agree.
And like Senator Martins and the Assemblyman said, you fail twice before you even have to get in. This is something it is acutely on our table and front and center. And we have to deal with the insurance companies, like you said.
Absolutely.
Senator Martins?
Just to follow up on that point for a second, Councilman, thank you. You know, one of the issues that I hear from my first responders as well is that they're now going back to the same place and reviving the same person several times. And so the question becomes, once you get to a point where you've OD'd on an opioid and they come in and they administer and they walk away, what is our responsibility as a state to require treatment?
Right.
Not to ask for treatment, not to put them on a path to treatment, and not to criminalize the activity. Again, we need to destigmatize this, but perhaps there should be an effort for us to require that person go into inpatient treatment, because for the very point that you brought up, if we are sending our emergency responders in, if we are administering Narcan, and if they OD'd, look, they have a problem, obviously. So as a condition, we can't just walk away and leave them with that problem. Perhaps something for the task force to consider is a requirement, again, not a criminal requirement, but a requirement that they get treatment as a condition of that as well.
Exactly, and I can tell you many times we get a call that comes in, and I'll hear it on the pager. I'll look at the text and say, we'll all say, oh, we were there last week, or we were there the month before. We're going back again and again, and it's also resources that we're expending that really shouldn't be. But we have to go in, and we gladly go in to save these people, but we know we're going to go back there again because hopefully we will save them.
Thank you. Thank you very much, Councilman.
Thank you. Thank you, sir.
I would, before I call the next speaker, the last couple of speakers brought up some good points, and one of them was I heard alcohol, which somehow escapes this debate statewide, and then I'm concerned, and I know there are people in the field who, and the clinical professionals in the room can tell you that if they treat 1,000 cases of people with heroin or opioid addiction, almost none of them never used alcohol or marijuana. And I feel like there's an omission in the primary prevention education piece that we've talked about, where we're sending mixed messages to young people at those early ages. You have states neighboring New York who are close to legalizing marijuana recreationally, like Vermont. And it creates a mixed message that I don't think some of us who grew up in the Just Say No days with the Reagans running around the country and the commercials on TV and getting it from every direction, I don't think we had mixed messages. So I hope that as we continue to talk today, if there's people who want to address the other gateway drugs, the ones that have some, particularly like alcohol, some of the worst detox symptoms, that'd be useful. With that, I'd like to introduce our next witness who will testify today, and that is Father Frank Pizzarelli from Hope House.
Gentlemen, thanks for the opportunity. I want to speak from a very, very concrete perspective. Obviously, I'm a clergy person, but I'm not here to say that I'm going to pray for you. I'm doing that already. I need the prayers too. Because for 30 years, I have been in the field working with addicts. Hope House has 55 beds. We don't use insurance. I've seen the epidemic grow to be a national health crisis. My concern are the concerns that have been echoed, but I think there are a couple of things that we also need to speak to. We don't have enough detox beds in both counties. There is a young man, as I am speaking to you right now, that is hitchhiking all along the South Shore trying to get into a detox. He has insurance, but there isn't a bed. And he may die because he's using Xanax. And he's out of control. But you can't force someone into a place where there is no place to be forced. So that's one thing. The other thing that is also very, very troubling to me is that the insurance companies, as I've already heard sitting in the audience, are really the people that are making decisions, that are really sentencing people to death. As a clergy person, in the last 10 years, I've buried 90 young people, just as a Catholic priest, who have overdosed on heroin. Half of those 90 were told to go to outpatient treatment and fail. And they did. They died, and their parents still today grieve over those senseless loss of life. The other problem that we have, as you also heard, is that if we're talking about heroin addiction as someone who provides residential treatment, it's got to be long-term. 28 days that are cut down to 10 days because of the bureaucrats that run our insurance industry is only setting people up for failure. I keep young men for a year to 18 months, and I'll be the first to tell you, it sometimes takes 8 months from these young men to finally reclaim their life and really want to open themselves to getting better, learning the skills of recovery, going back to a world that is drug-infested. And that's a whole other question probably for another day. I mean, there is not a job or an industry where drugs and alcohol are not infectious and out of control. And I'm not proposing prohibition. But the reality is that those who suffer from an impulsive-compulsive disorder, they need to develop skills to cope and to survive in that world that I've just described. And if you think that can be done in 30 days, unfortunately, I'll draw on my training in 30 years of doing this. It's not going to happen. And so we are pissing money away, excuse my French. We're wasting money that could be better used. The other thing that I think you need to be aware of, and this is something, a new phenomena that's very disturbing in Suffolk County, is that I live on the Gold Coast, the North Shore. We can now call in and get a heroin order delivered to one's home. That's problem number one. Problem number two, which is most disturbing because most of us are familiar with the 12 steps, AA and NA, wonderful resource in any community. The problem is that these very disturbed drug dealers are showing up at these meetings, and they are peddling their wares to guys and gals that are very vulnerable. And so I think we need to really step up enforcement in places that we know are providing that kind of support, because that's really becoming a problem. And finally, the biggest piece is that we know that insurance is part of the problem. We need to make grants and other resources available so people like myself and others that are sitting behind me that are committed to the work, that there are the resources to provide the kind of treatment that is necessary without money being a block. Thank you very much.
Thank you, Father. Thank you very much. Next, we'll be hearing from one of our councilmen from Islip Township, and that's Councilman John Cochran, Jr.
Good afternoon,
Councilman.
Senators. How do you let me follow Frank? If you have not been to one of the Hope House, I'm honored each year to, with a friend of mine, Mr. Rampone, to see the men that come out of Hope House. And that's where our goal should be, is if there's somebody gets trapped in this addiction, to have those facilities that Father Frank does to provide for these young men, that's all he does, because I'm seeing it on Main Street. And Tom, you know, as supervisor, when we started our journey 5 years ago in the town, this was kind of an undercurrent. Well, it's not. It's on Main Street. We're seeing it every day. And it's not just in CI, in Brentwood, and Bayshore. We're getting arrests in Great River, in Brightwaters, in West Islip. And we go to the 3rd Precinct once a month for briefings. And when you hear the stories, we find out the houses that are there. Our hands are kind of tied, legislative-wise, for the town, for our codes. We report to the 3rd Precinct, and it seems like there's an area there that we can't get these dealing houses out of the public view. I'm an insurance guy. Whatever he's saying, Father Frank said, yes, you guys legislatively can hopefully work with our rehab facilities, but on Main Street, we have to find ways that we know a house in Bohemia is selling heroin, that we can close down on that and unleash the handcuffs of our local police department, and our town can't do it, but our police departments, because that is our frustration. We know they're dealing, and we can't shut that operation. And they're going in there all times of night. People are getting houses shot up, because once it's the drug house, then you have gang activity. And it's just, for a town, for our codes, we can't really attack that until it's after effect, and we can't, now it turns out to a zombie house and goes on and on. So drug addiction on a town level, for me, is a path that the individual is going down, but as a town, I can't do anything socially for that individual. We have to rely on other courses of action. But the codes and attacking of our drug pushers and our houses, that's what we need help from Albany to unleash the handcuffs and enforcement to stop this, because it is a weekly, and not daily, another story coming through Town Hall. And I want to thank you all, Tom, for sharing this, Phil, the rest of you senators, because we see it, guys. You see it. You're from Bohemia. You know, we get that when you go to the Ronkonkoma Bohemia Civic. You didn't think you'd hear those kind of stories, and that's what we're getting every week, every day, coming from neighborhoods you'd never think this problem would have. So I want to thank you. Again, continue this hard work, because the bottom line is we have to get our people that are addicted to this back to the straight path. And us, for the town, we want to do whatever we can to make sure our communities are safe. So thank you again, Senators.
Thank you, Councilman. And I'd also now like to have up Councilman Cochran's colleague on the town board, Councilwoman Mary Kate Mullen.
Good afternoon,
Councilwoman.
everyone. It's a pleasure to be here. I think I bring a unique perspective in that, although I'm newly elected to the town board, prior to serving as a member of the town board, I started my career in law 20 years ago. I spent 8 years in the Suffolk County District Attorney's Office. 5 years of that time was spent prosecuting narcotics cases, where I just handled heroin, crack cocaine, pills, Xanax, and just drugs of that nature. After I left the DA's office, I became a criminal defense attorney. So I've seen both sides. When I was in the DA's office, I found that most of the cases we prosecuted were people who were selling to support their habits. We did have a lot of the larger quantity cases where we did long-term investigations. However, for the most part, my volume was people just getting arrested, doing hand-to-hand sales, being arrested by undercover officers, and they wound up going to jail, becoming a predicate felon, and then getting another term in jail. And back then, the minimum time was 3 to 6. The laws have changed. There's been some relaxation of the Rockefeller laws and other programs within the court system. There's a diversion program. There's now a drug court in Suffolk County. When I got out and started my practice doing criminal defense work, it was really heartbreaking to see these people who I was putting in jail now coming to me and hearing their stories. For instance, I had one client who became addicted to pills after suffering a break of one of his bones while wrestling. He was a varsity wrestler in Sachem and had a compound fracture and was prescribed pills. After that, he, of course, got cut off from the pills eventually and turned to heroin. And from there, he was just in and out of jail. Finally, he called me one day desperate. He was down in Florida because he couldn't get into a rehab program up here. And as Councilman Cochran pointed out, it's becoming a problem that we have to deal with locally. We see it on Main Street. I'm a runner. I go out for my morning run, and I live in Bayport. And unfortunately, I'm seeing needles and bags of needles and paraphernalia down by the water, down by Browns River, down along Middle Road, Bayport Commons. It's everywhere. I have a friend who lives down off of South Ocean Avenue, and he, in fact, walked up upon someone shooting drugs in their car. The girl took off with her stuff, but she left a bag, and in that bag was her license. So what did he do? He drove to her house and handed the license to the parents and said, "This is what your daughter's doing. So I think you should be aware." Now, how can you not be aware? I'm sure they were, and unfortunately, this girl's an addict. As a mom of 3, I feel like it's my job to drill in my kid's head. Don't even try it. Tom, as you said, growing up in that era, just say no. I believe we need more education. It starts in the schools, and we have to reach out to those children who maybe don't have the parental guidance to just say no, and to teach them to just say no before they wind up in the court system, before they wind up as my clients. And I feel that the rehab programs up here, we need to extend them, like you guys have mentioned. From what I've been told, it takes 18 months to reprogram your brain so that you're drug-free. And I found that my client, who was desperate and went to Florida, wound up in and out of jail. You know when he did the best? After he came out of jail. After he did 4, 6, 8 months in jail. He came back looking healthy rather than, like he was on his deathbed. So I appreciate the opportunity for me to speak to you, and appreciate any input that you can give us as local officials that we can help you as well. Thank you.
Thank you, Councilwoman. And so much of what we're talking about, you're seeing the other effects of addiction in the communities, and that is how it affects the bedroom communities of suburbia, the blighted homes that result when there's drug use in the homes, and I know that's a challenge for our local elected officials. But to your point about, just say no, the bully pulpit is a very powerful thing in our republic. It's nothing to laugh at or to sneeze at. It's a very powerful thing, from the presidency to the chief executives of our towns, our villages, and our governor. And I think if you had a top-down approach, as we did then, you were reducing the demand signature for this drug, which is something that we saw for a brief period, but in the 80s and in the 90s. So I think the more the bully pulpit is used, to your point, Councilwoman, the better. I'm joined by my colleague and the dean of our delegation, Senator Ken Laval. Thank you, Senator, for joining us today. And with that, we're going to, speaking of the towns and villages, we have one of our chief executives. Next witness will be Mayor Morris Sperry from the village of Mastic Beach. Take him next.
First, I just want to thank Senator Croce for putting this on, and I want to thank all of you for taking this unbelievable problem head on. I really want to hear from the parents and the people who are most affected, because I think their stories really are the ones that touch us the most and really explain the depth of the problem. But I wanted to just make 2 points. Tonight I'm going to be going to the town because our ambulance company is getting a new building, which is great. But our ambulance company has almost 3,000 calls a year, and many of them are around drugs and drug overdoses. We have a tremendous problem with vacant homes, with squatters. Most of these houses have people using heroin and drugs. So they've had an increase from, I think, over 50 calls last year. At the beginning of this year, I think in the first 2 months, they've had 26 overdose calls. So we see exponentially how much more serious the problem has become and how quickly it's become. And I've talked a lot with the chief of the ambulance company in the new building. He wants to do a counseling maybe not a center, but set up a place where we can have counseling over. One of the things he finds very frustrating, as was spoken about, is he goes back to the same people over and over again, sometimes 3-4 times. They're using Narcan to help people who have OD'd. And what he really feels like is there's missing the counseling part for these people. And lastly, I want to talk about my own personal experience. I grew up in Westchester County, and when I was in grammar school, they put out a comic book. And the comic book was about heroin and heroin addiction. And I can tell you now, as a 56-year-old, that from when I was in grammar school back in Larchmont, New York, that comic book was extremely effective. I have never in my life, and believe me, I'm a free spirit, wanted to experiment with heroin or any drugs like that specifically because of that comic book. And I'm going to tell you, I think it would be effective. Start young. It's not high school. Start in grammar school. You cannot start young enough. And like you said from the bully pulpit, in our schools, let these kids know. And it was graphic, that comic book. It made it horrible. Like, who wanted to be a junkie? It was awful. So I really would encourage everyone to think about doing something like this comic book to the grade school, to the kids in the elementary school. Let's get them young as can be, and really kind of just really let them know how dangerous it is. Thank you so much.
Mayor, we're very honored to have our leader of our county government here today, and it seems as though since he and I have entered public office, we jumped from one crisis to another. Fortunately, we're able to get to the next crisis because we power through, and that's a testament to his perseverance and his vision. And so I'm very happy to be joined by the County Executive, Steve Ballone, and his team, who will share some words with us.